Maya didn't see the truck coming. Not a literal vehicle, but the microscopic collision that was about to derail her pregnancy at 28 weeks. Unlike the common cold, which politely knocks on the door with a sniffle or a scratchy throat, the flu doesn't knock. It kicks the door down. And for Maya, the transition from healthy to incapacitated took less than 60 seconds. She did what most of us would do. She bargained with her body, Googling pregnancy fatigue and sipping herbal tea, convincing herself that a nap would fix what felt like a sudden system failure. When the thermometer read 100.4, she made her first critical mistake. She treated the number as a suggestion rather than a starting gun, assuming she could sweat it out like she did before she was pregnant. By nightfall, the virus was no longer just knocking. It was burning the house down, sending her body into violent rigors that she mistook for just being cold, burying herself under blankets that only trapped the rising heat. Deep inside, the influenza virus was exploiting her suppressed immune system, turning her own body into a furnace, a biological fire that her baby was now trapped inside with no way to escape. She woke in the dead of silence, the kind of heavy, oppressive quiet that screams that something is wrong, her hands flying to her stomach to find the movement that had been constant just hours before. The bottle of Tylenol, the one thing that could have acted as a fire extinguisher hours ago, sat unopened on the nightstand, a testament to the dangerous myth that toughing it out is safer for the baby. When she finally forced her eyes to focus on the digital display, the number wasn't just a fever, it was a siren. 103.2 is the threshold where maternal antibodies stop protecting and maternal heat starts damaging. The drive to the hospital was a blur of rain and regret, every bump in the road amplifying the body aches that felt less like the flu and more like her bones were being crushed from the inside. She had expected a long wait in the ER, but the moment the triage nurse felt the heat radiating off her skin, the protocols changed, because a pregnant woman with a high fever isn't just a sick patient, she is a high-risk event. The triage nurse didn't ask about insurance. She moved with the speed of someone who knows that in obstetrics, fever is a teratogen, a toxin that can stress a fetal heart to its breaking point. As the Doppler amplified the sound of her baby's heart racing at 180 beats per minute, the doctor asked the question that would haunt her. How long have you had this fever? Maya realized then that she hadn't just caught a cold. She had missed the warning signs of a predator, and by the time she reached the hospital, the golden window for early intervention had already slammed shut. To the untrained eye, the common cold and the influenza virus wear the same disguise: fatigue, congestion, and that general feeling of being unwell. But under the microscope, one is a nuisance and the other is a predator. The rhinovirus, responsible for the common cold, is a local tourist. It lands in your nose and throat, sets up a small camp, and causes localized chaos that is annoying but rarely threatens the pregnancy itself. Influenza is different. It is a systemic invader that drills past the initial barriers, flooding your bloodstream and aiming to hijack your entire metabolic system within hours. The first clue in our forensic analysis is velocity of onset. A cold is like a dimmer switch, turning up your symptoms slowly over 3 days. A tickle on Tuesday, a sneeze on Wednesday, congestion on Thursday. The flu is a light switch being flipped, or more accurately, a dump truck unloading bricks on you. Patients can often recall the exact hour they went from fine to flattened. Then there is the thermometer war, the most critical differentiator for fetal safety. A cold might give you a mild elevation, hovering around 99 or 100 degrees, which is uncomfortable but manageable. The flu produces the spike, a rapid ascent to 102, 103, or higher, and this is where the biology of pregnancy turns dangerous. Inside the womb, your baby is floating in a temperature-controlled pool that relies entirely on your body to regulate it. The fetus cannot sweat or pant to cool down. When your core temperature spikes, effectively boiling the bathwater, the baby's only defense is to race its heart, leading to fetal tachycardia as it struggles to pump blood fast enough to dissipate the heat. In early pregnancy, this heat can disrupt neural tube development, but in the third trimester, it creates a massive oxygen demand, burning up the oxygen the baby needs just to keep its baseline metabolism running. Our third clue is the ache factor. With a cold, you might feel stiff from coughing or tired, like you need a good nap. With the flu, the body aches are profound and skeletal. Patients describe it as their skin hurting to the touch or feeling like their bones have been bruised, a result of the massive inflammatory cytokines flooding the system. Fourth, look at the location. A cold keeps the party in your head. Runny nose, sneezing, sinus pressure. It's a wet and heavy feeling in the face. The flu moves south to the chest, causing a dry, hollow hacking cough because the virus is stripping the protective lining of your lungs, leaving them raw and vulnerable to secondary pneumonia. You might think, I'm healthy, I eat well, I exercise, I can fight this off. But pregnancy changes the rules of engagement. To keep your body from rejecting the baby, which is technically foreign DNA, your immune system naturally lowers its shields, creating a gap that the flu virus exploits to replicate faster and harder. This brings us to the 48-hour curve, a mathematical reality that dictates your outcome. Viral replication is exponential, shooting up vertically in the first 2 days. If we intervene within this window with antivirals, we can glue the virus inside the cells, stopping the spread. But once you cross that 48-hour line, the viral load is often too high to contain. This is why the wait-and-see approach, which works fine for a cold, is the most dangerous strategy you can use for the flu. By understanding this decoder grid, fast onset, high fever, severe aches, dry chest, you stop guessing and start acting.
Elena's story starts exactly where Maya's did, with a sudden, inexplicable crash in energy at 30 weeks pregnant, right in the middle of a workday. She noticed the first red flag immediately, the wall. 1 minute she was fine. The next, she felt like she had been unplugged from a power source. Unlike Maya, who rationalized the symptom as pregnancy fatigue, Elena applied the decoder rule. Pregnancy exhaustion is gradual and constant. The flu is sudden and violent. She didn't wait for the fever to spike. She checked the time, 12:30 p.m., and started her stopwatch, knowing that the clock was already ticking on the antiviral window. When her temperature read only 100.1, she didn't dismiss it as safe. She combined it with her other data points, sudden onset and body aches, and realized she was in the early stages of a systemic attack. Her phone call to the provider was not a request for permission. It was a report of a tactical situation. She said, "I have a sudden onset of flu symptoms and need a swab immediately," bypassing the usual wait-and-see advice that receptionists often give for common colds. When she met resistance, the suggestion to just take Tylenol and rest, she didn't get angry, she got technical. She used the magic words, "I am concerned about fetal tachycardia and need to catch the 48-hour window for Tamiflu efficacy," which immediately flagged her chart for triage review. Because she pushed, she was swabbed just 4 hours after her first symptom, catching the virus while it was still establishing its beachhead, long before it had overwhelmed her system. The rapid test confirmed influenza A, and she took her first dose of oseltamivir in the parking lot, effectively locking the virus inside the infected cells before it could spread to her lungs. That night, Elena was sick. She felt miserable and tired, but she wasn't in danger. Her fever never crossed the threshold of 101, her body ached, but she wasn't convulsing, and most importantly, inside the womb, the environment remained stable. While the virus tried to replicate, the medication held the line, keeping her core temperature safe and her baby's heart rate within the normal rhythm of 140 beats per minute. By the next morning, the fever had broken, turning what could have been a hospitalization event into a manageable weekend on the couch. Elena wasn't lucky, she was vigilant. She recognized the difference between a cold and a crash, and she acted before the fire could spread. She proved that you don't have to be a doctor to save your baby. You just have to know when to stop being a patient and start being a parent. Now that you can decode the difference between a cold and the flu, let's equip you with the toolkit you need to defend your pregnancy. First, accuracy is everything. Toss out the forehead strips or hand-to-forehead checks, because cool skin can mask a high core temperature. Use a digital oral thermometer placed deep under the tongue for the only reading that counts. If it says 100.4 or higher, that is your signal to act. Second, medication safety is non-negotiable.
Acetaminophen, Tylenol, is your primary weapon to lower fever and is considered safe in pregnancy. However, you must strictly avoid ibuprofen, Motrin, or Advil, as these NSAIDs can cause the premature closure of the ductus arteriosus, a vital heart valve in your baby. Third, when you make that call to the on-call line at 2 a.m., don't be vague. Use the vigilance script to cut through the noise. State your gestation clearly, give your exact oral temperature, describe the sudden onset, and specifically ask about the flu protocol. This forces the provider to assess you for high-risk influenza rather than dismissing a common cold. Fourth, break the dehydration loop. Fever burns through your amniotic fluid levels and blood volume rapidly, which can trigger preterm contractions. If you cannot keep water down due to vomiting, that is not just being sick. That is an emergency that requires IV fluids to protect the placental flow. Of course, the best battle is the one you never fight. The flu shot is the only intervention that protects 2 patients at once. It trains your immune system to recognize the predator, and remarkably, it passes those antibodies through the placenta, arming your baby with protection for their first 6 months of life outside the womb. Ultimately, remember the red flags that require immediate emergency room evaluation: shortness of breath, chest pain, confusion, or any decrease in fetal movement. Maya relied on hope, but Elena relied on vigilance, and that decision made the difference between a tragedy and a recovery. You are the expert on your own body, and in the world of high-risk obstetrics, your intuition, backed by data, is the most powerful tool in the room. Trust the signs, check the temperature, and never apologize for advocating for the safety of your child. Please review the following medical safety disclaimer and emergency indicators carefully. Spot symptoms, take action, stay safe. Subscribe to the Pregnancy Vigilance Hub to visualize the invisible and decode your pregnancy symptoms today.